Good morning, everyone. Welcome to the COVID-19 quarantine and isolation requirements presentation. My name is Kaylee Hervey, and I'm the Epidemiology Program Manager for the Sedgwick County Health Department. And thank you for joining us. All right, next slide. And then my contact information is available if on the slide if you have any questions and would like to reach out to me after this meeting. Next slide. So the objectives for today's presentation are understanding isolation and quarantine, learning more about the Sedgwick County guidelines, looking at possible scenarios, new guidelines for fully vaccinated individuals, testing options, and helpful website tools. Next slide. So first I want to talk about some definitions. So the reason we have quarantine and isolation are to prevent individuals from spreading the virus. These are going to be specific to COVID-19, but we use isolation and quarantine to prevent the spread of other illnesses such as the flu or chickenpox. So quarantine, the definition of quarantine is people who are considered close contacts of a person who has tested positive for COVID-19. They're going to be placed into quarantine. Isolation is a person who tests positive for COVID-19. So if you want to remember it, remember isolation means you're ill, whereas quarantine means you're a close contact. Next slide. So for COVID-19, Sedgwick County does allow a modified quarantine. For early on in COVID-19, you may remember that the quarantine was for 14 days. And the reason that 14 days is set is it is the time that someone who could, from exposure to when they may develop COVID-19. And so if they're going to develop it after exposure, it's within those 14 days. However, about halfway through the pandemic, CDC and KDHE did create an option for a modified quarantine to allow people who may not be sick to go back to work a little bit faster or return to school a little bit sooner, as long as they follow set guidelines. So Sedgwick County residents who are exposed to COVID-19 positive individuals may complete an in-home quarantine for a shortened length of time of 7 to 10 days if they remain symptom-free and follow all KDHE guidelines. Next slide. So we're going to talk about a scenario first. So this is someone who has no symptoms and a negative test. So this person would qualify for a 7-day modified quarantine. When you're exposed to COVID-19, we count that as day 0 for your 7 to 10 day countdown. So if on day 0 you're exposed, then you need to be at home in quarantine through day 7. The allowance for the modified quarantine is that you can be tested for COVID-19 on day 6, as long as that test is a PCR test. It can't be an antigen test, it can't be an antibody test, it has to be a PCR test. And then if your tests are negative from that day 6 test or later, then you have to quarantine through day 7. And on day 8, as long as your results are back, you may resume your normal activities. If your results are still pending on day 8, then you need to remain in quarantine until your results come back. If for some reason, before day 14, because we still want you to monitor for symptoms for the full 14 days, if you develop COVID, say in this example on day 11, you become symptomatic, then you would need to go into isolation and be tested again, because it is still within that 14-day period and you could have developed COVID-19. Next slide. Now, if you're not going to be tested, we know a lot of people don't want to be tested for various reasons. If you're not going to be tested and you don't have symptoms, then you would follow the modified 10-day quarantine period. But again, you would want to monitor for symptoms for the full 14 days. So day 0, as I stated earlier, is going to be the date that you were exposed to COVID-19. From day 0 until day 10, you'll need to stay at home and monitor for symptoms. If you don't develop symptoms by day 10, then you can leave that in-home quarantine on day 11 and resume your normal activities. If you do develop symptoms still within the 14 days, so in this case, day 13, then you would need to isolate and be tested because you may have developed COVID. Next slide. So for this scenario, we're going to talk about the difference between household contacts versus non-household contacts. So for household contacts, you have to remain in quarantine for the entire time that the person in your household who is positive has COVID, then the 7 to 10 day quarantine period. So if you're living in the same household, then you would need to be into quarantine for that isolation period, which we'll talk about here in a minute, but it's going to typically be 10 days plus the 7 or 10 day timeline. Next slide. So if for some reason the someone else in your household, if you're a household of 4 and one person developed COVID and you're that person's household contact, and then 3 days later somebody else in your household develops COVID, so you're still a contact of that original person, but you are now also a close contact of the second case in your household. And so that means your quarantine period is going to start over. So anytime a new person in your household develops COVID, or you're re-exposed to someone else as a close contact, your quarantine period will start over. It's always going to be the last date of exposure will be that day 0. And so quarantine is going to be 7 to 10 days from the last exposure, as long as you're not showing any symptoms. Next slide. And then this one I kind of talked about a little bit earlier. So if you're not able to isolate away from someone in your household, then you would, again, have to be that full period of isolation, and then your quarantine would start when that person leaves isolation. If that person is able to isolate away, for example, they can live in the basement, you live upstairs, you have 0 contact, then you can start your quarantine period, that countdown, from whatever the last day you were around that person. So if it's not possible, then it would be the entire isolation period plus that 7 to 10 days. Next slide. However, there are some quarantine exceptions for people who are fully vaccinated. It's one of the benefits of being vaccinated. So someone who is fully vaccinated does not have to quarantine for an exposure to COVID-19 as long as they remain symptom-free. So if you are a close contact of someone with COVID-19 and you are fully vaccinated, even if they live in your household, you don't have to quarantine. For these purposes, someone is considered fully vaccinated 14 days after completing the required doses of vaccine. So if it's a Pfizer or Moderna vaccine, it'll be 14 days after the second dose. If it's Johnson & Johnson, it's going to be 14 days after their first dose. So once you reach that 14-day period, after that, you do not have to quarantine if you're exposed as long as you don't have symptoms. And it used to only be a short period of time, but the CDC has eliminated all in-time limits now. So for any time after you were considered fully vaccinated, you don't have to quarantine for exposure as long as you don't have symptoms. Next slide. However, if you do develop symptoms after exposure, whether you're vaccinated or not, then you need to do a few different steps. The first is going to be scheduling a test. You're also going to want to stay at home until your test results are received. You need to separate yourself from others. You may have COVID, you may have a different illness, but we want to keep you away from everyone else so that if you do have COVID, you're not spreading it to others. We're going to recommend that you wear your face mask or face covering, again, to prevent you from spreading the illness. Monitor your symptoms. Make sure you're covering your coughs and sneezes. Don't share any household items. And clean and disinfect household items frequently. And this especially is things like doorknobs or faucets, things that you and your family touch a lot. Those are the things you really want to make sure you're cleaning frequently. Next slide. So Sedgwick County Health Department does offer no-cost testing at the Sedgwick County Park. We're in the Sunflower Shelter right now. And the easiest way to get to that is off of 13th Street exit, and then just follow the signs for testing. There is no appointment needed. We are just a walk-in clinic. You can just walk in and get tested. And that is going to be a PCR test. We offer different types. It can be the nasopharyngeal, an oral, or a saliva test. And right now our hours are Monday, Tuesday, Thursday, and Friday, 8 a.m. to 3:30 p.m. And then Wednesdays are 8 a.m. to 6 p.m. And if you would like to get more information about our testing location or other testing locations nearer to you, you can follow the link on the slide provided. Next slide. So when you are tested, and these are kind of specific to our Sedgwick County testing, right now our test results are available in 1 to 2 business days or potentially sooner. Other labs may take a little bit longer or a little bit shorter, but that's what we're seeing right now for our results. However, what you do when you get those results is the same no matter where you're tested. If your test results come back negative, then you don't have to be in isolation because you don't have COVID. However, you would need to stay in quarantine until you've reached the end of your quarantine period. So if you get tested on day 6, your results come back on day 6, you still need to remain in quarantine until the end of day 7, and then you can resume normal activities on day 8. Now, if your results come back positive, you'll need to remain in isolation until you're recovered. And next slide. And so a person should remain in isolation for at least 10 days after symptom onset. And so most cases, individuals can be released from isolation after 10 days or 72 hours after the end of symptoms, whichever is longer. So in Sedgwick County, we follow KDHE's guidance, which differs a little bit from CDC. And so it is that 10 days or 72 hours after the end of symptoms, whichever is longer. And when you do test positive, we will have somebody reaching out to you to kind of help you figure out what these dates and, when you can leave isolation, what do your symptoms mean? What's COVID, what may not be. We will work with you to make sure you're remaining in isolation as long as you need to, but not longer than you should be. Next slide. And so we do have some online resources. If you do want to learn more about COVID-19, you can go to our general COVID-19 website. We also have information about testing, quarantine, and isolation available. And if you have any questions, definitely send us an email. That COVID-19@sedgwick.gov is kind of our main COVID email. Just reach out to us and we're answering those questions as quickly as we get to them. So usually within a day, maybe 2 business days at max. And so are there any questions at all for me?
Thank you, Kaylee. Appreciate you presenting this morning. I'm going to go ahead and move on to the next part of the presentation, which is going to be on keeping employees and clients safe from COVID-19. My name is Valerie Florio. I'm the COVID-19 liaison for the Sedgwick County Health Department, and there is my contact information via email there. Some of the things that we're going to talk about this morning are going to be prevent and reduce transmission among the employees, maintaining healthy business operations, maintain a healthy work environment, provide PPE for employees, additional employment stress, addressing the mental health impact, and then 5 key takeaways. So we're going to get started this morning with ways to prevent and reduce transmission among employees. First one is we're going to actively encourage sick employees to stay home. CDC is actually recommending that to testing for people with any signs or symptoms of COVID-19. Employees who are sick with COVID-19 or asymptomatic should isolate and follow the CDC guidelines. Employees who are well but have a sick household member should notify their supervisor and also follow CDC precautions. Employers are encouraged to implement flexible, non-punitive sick leave. We also recommend conducting daily in-person or virtual health screenings. An example of that would be the temperature screening. Identify where and how employees might be exposed to COVID-19 at work. Some of the things that you could do in that area might be conducting a thorough hazard assessment of your workplace to identify potential hazards and determine what type of controls or PPE are needed for the specific job duties. You could select and provide appropriate PPE to the workers at no cost and train the workers on its correct use. You could also encourage and ensure that all employees wear masks and remind employees and customers that CDC recommends wearing masks in public settings, flyers. Excuse me. The other thing, I lost my train of thought there, sorry about that. The other thing you could do is you could provide flyers in entrances, employee break rooms, and also provide announcements over PA systems about potentially virtual health screenings and that type of thing. You can identify where and how employees might be exposed to COVID-19 at work. You should always send sick employees home immediately. that provides kind of a barrier as soon as you see that somebody might be coughing a lot or something to that effect. Getting them away from other employees as soon as possible is very important. And then also educate employees on how to protect themselves at work and at home. Some of the flyers that we have available to you, all of these would be found on our sedgwickcounty.org website. There's a couple of examples there, different things that you should know about the COVID-19 vaccines. They're available at no cost, they're safe, they work, and they protect everyone. And then also benefits of a COVID-19 vaccination, which of course we get into things like how you can help stop the spread of COVID-19. Again, it's no cost and accessible, it's safe and effective. Protect yourself, family, and friends. And you can get out there and resume the activities that you enjoy. And just again, it encourages you to get your COVID-19 vaccine. So these are posters that you can request or you can print out yourselves. If you do request them, give us 3 to 4 days to get them printed and out to you. Here's a couple more examples. We've got a myths and facts COVID-19 sheet, and then just a flyer that kind of targets the 12 and over population. And then we're getting into the maintaining the healthy business operations. It's important to implement flexible sick leave and be supportive of people using sick leave when they are sick. Protecting employees that are at a higher risk for severe illness. One of the examples of that could be allowing them to work remotely. Communicate supportive workplace policies clearly and frequently using multiple methods, things like texts, emails, and phone calls. You can assess your essential functions, determine how you will operate during the spikes and absenteeism, making sure you have other people trained to do, other people's jobs. Cross-training is really important in this time. Establish policies and practices for social distance. I'm still recommending staying 6 feet away and barriers between them and the public if possible. Hand washing and mask expectations, and then policies for clients and staff. Consider potentially improving your building's ventilation. If you think that might be an issue, that is something that you can look into. And the other thing that we encourage is giving employees, customers, and visitors the things that they need to clean their hands. So hand sanitizer readily available. Performing routine cleaning and disinfection, that's very important. And then minimizing the risk to employees when planning meetings and gatherings whenever you can. We'll get into the PPE a little bit. Employees are obligated to provide workers with PPE if it is needed for them to stay safe while performing their jobs. The types of PPE that are required from COVID-19 are based on the actual risk that an employee has of becoming infected. Correctly used PPE can help prevent some exposures, but it should not take the place of other prevention strategies. So that's an important takeaway there. Examples of PPE would be things like plastic gloves, goggles, face shields, the masks, of course, and then other types of respiratory protection. During an outbreak of COVID-19, PPE would depend on the risk and the effectiveness of the PPE. And it could also, that type of thing can change regarding what they would recommend if there is an active infections. There may be more PPE that's required when you're going through something like that. All PPE should be selected based on the hazard to the employee, needs to be properly fitted, consistently and properly worn. That was a big thing with masks, as people were wearing their masks under their nose, always encouraging people to pull that mask up over their nose. Being regularly inspected, and then it needs to be properly removed, cleaned, stored, and disposed of. Talk a little bit about the COVID-19 rapid testing. That is a test that's very easy to administer. Results are quick, within 15 minutes or so. and it could rapidly test whether or not somebody is symptomatic and asymptomatic. Provide real-time input to mitigate the risk of large gatherings by identifying individuals who pose a transmission risk. So that's a really important reason. If you're having a lot of people, a large group of people rather, it might be a good idea to provide some sort of COVID-19 testing. Offer a scalable testing option for recurrent screening programs. So it's important to have something that could be edited and changed as needed. Only requires completion of a training video to learn how to administer. All of those videos would be available on the CDC website and could receive them at no cost from KDHE. KDHE stands for the Kansas Department of Health and Environment. Kansas Department of Health and Environment also has Binax Now test kits. They have a supply of those rapid tests that can be provided to employers free of cost. It's a straightforward process, very easy to apply. You need to obtain a CLIA certificate of waiver and then agree to report results for the tests. Must offer tests for free. And then for more information, there is a link that you can click on. Employee mental health. That's a big thing right now. The COVID-19 time is very, very stressful. Besides addressing the physical safety of employees, you also need to recognize increased taxation on their mental health. Coronavirus pandemic is heightened the stress for millions of Americans, and the lack of physical contact with family and friends combined with the added stress can pose some pretty serious health concerns for employees. So when you're addressing the mental health impact, keep in mind you want to have effective communication. You want to have open communication channels. You want your employees to feel like they can talk to you. And then you can have human resources or supervisor check-ins with employees to see how they're doing. Have a safe and committed working environment. Consider doing, remote tasks, hybrid work schedules where you can be a little bit flexible with work schedules, and then be prepared for redistribution of tasks. Access to mental health care, support the initiatives, mental health resources to make sure that they're out there for your employees, and have a more expanded employer assistance program if you can. It's just very, very important to make sure that the access to mental health services are out there for your employees. So there are some CDC resources for mental health. As I mentioned earlier, you can click on these and you can save these links. There's a lot out there right now on managing stress and anxiety. We know that a lot of people during the pandemic, and especially during the early days when a lot of people are at home quarantining, essentially isolating or just being home and avoiding crowds, they not having access to people, and not having somebody that you could talk to, really stressed a lot of people out in that respect. And anxiety and depression and things like that have really increased. So it's just really important to think about mental health if you can. 5 key takeaways today that you can think about in regards to keeping employees and customers safe. It's just important to stay informed. We keep our website up to date. So check the Sedgwick County website and any of our social media pages. We put the newest information out there. And then definitely check out the Kansas Department of Health and Environment and the resources that they have. It's also very important to understand the risks, employ and enforce precautions when you can, recognize the signs and symptoms, and then also recognize employees' mental health. So with that, are there any questions that I can answer? And if I can ask you to do a quick post test and launch this for you. Now just kind of judge after everything that we just threw at you there in a short amount of time. If you can think about that in relation to how you started, which is versus how you feel now after receiving this presentation. And then we do have this last page here, shows the link straight to our vaccine related information there. And then there's a link for the Kansas Department of Health and Environment vaccine page as well. And then with that, we will go ahead and we will conclude for today. I'd like to thank you for joining this webinar. We will make the information available on our website as soon as we can. If you have any questions, please, let me start over. Please feel free to contact us at the Sedgwick County Health Department. You can call 660-1022. And you may have to leave a message. You leave a message, we do return our phone calls within 24 hours. And then the COVID website and the COVID email that Kaylee mentioned earlier in the presentation. So again, thank you for joining us. With that, we will conclude for today.